Acne is already tough enough to deal with, but what can be even more frustrating is the scars that it leaves behind. So today I'm talking you through all the ways to treat acne scars. I'm Dr. Sam Ellis, and I'm a board-certified dermatologist in Northern California, and I'm here to help you understand your skin and find products and procedures that work for you. If you like this type of content, give the video a thumbs up and don't forget to subscribe to the channel. What I'm about to say is going to feel quite obvious, but I need to say it, and that is, before you treat your acne scars, you need to have your acne under control. It is so common that I have a patient on my schedule for a cosmetic consult to talk about acne scarring, but when they come in, it's very clear that they are still breaking out. And of course, they have scars as well that they want to address, but before we can treat their scars, we need to get their acne completely cleared. And really, this is because acne scarring treatment is an investment in both time and money, which I will get into, and it's so important that if you're going to spend that time and money to address your scars, that you don't continue to break out and reinforce the problem. Now, it will be true of some individuals that they will continue to get small breakouts periodically. For example, a lot of women will get like one recurrent pimple every month with their period. But I'd say if you're getting more than a couple pimples a month, your acne isn't under the control it needs to be to treat your acne scarring. And the other reason for this is not just because I'm being mean and I don't want you to be able to treat your acne scars, but it's because a lot of the treatments we use for addressing acne scars go deep into the skin and can cause some temporary inflammation of the deeper tissues that can actually lead to additional acne breakouts in the interim. So if your acne isn't under excellent control, we could in theory flare your acne while we're trying to treat your scars, and that's problematic. So acne scars kind of come in many different flavors or versions, if you will. And it's important to understand the different types of acne scars because the treatments that you choose to address those scars will vary based on that. One thing that's not technically an acne scar, but many people think of it as scarring, is something called post-inflammatory hyperpigmentation or post-inflammatory erythema. And those are respectively the brown marks or the red or pink marks that are left behind after your acne heals. And when you have that, it doesn't cause any textural irregularities to the skin, but it's still a blemish that is left behind when your acne is gone. And the reason I don't consider those a true acne scar is because that irregular pigmentation will eventually fade over time, but in some people it can take 6 months to a year to do that. So I will be talking about a couple of ways you can kind of expedite the resolution of the redness or brown spots that is left behind by your acne marks in this video. When I'm talking about a true acne scar, what I'm really talking about is some type of permanent textural irregularity in the skin caused by previous acne. And you can have two main types of this. You can have atrophic acne scars, which is what most people are coming in for. So those are divots or undulations in the skin. And then you have hypertrophic acne scars, which are actually bumps caused by previous acne. Now, there are multiple different types of atrophic scars, and I'll get to them in a second, but the main cause of these is that rapid inflammation that happens when you have an active acne mark. It can lead to destruction of the collagen and sometimes even the fat that exists locally in that area of skin. And then as you heal from that, the collagen in that area can be destroyed or irregular, which causes a divot in the skin. There are three main types of atrophic acne scars: boxcar scars, rolling scars, and ice pick scars. Boxcar scars essentially look like little craters on the skin. They have very distinct drop-offs or edges and then sort of a flat bottom. Rolling acne scars are essentially exactly how they are described. It looks like these softer undulations in the skin where you don't have distinct borders, but just a general irregular texture. And then you have ice pick scars, which are narrow V-shaped scars. They're quite pinpoint and they can be quite deep. And then you have hypertrophic acne scars, which are actually much more common on the chest or back, and it's where you're seeing a thickening and a raising up of the skin. You can get these on the face. I see it most commonly along the jawline, and that's a whole different type of scar. Now, I think a lot of people assume that in order to get acne scars, you have to have deep, inflamed, cystic acne, but that's not always the case. Whether or not you get acne scars is primarily determined by your genetics and how your skin tends to heal. Now, certainly, if you have lots of acne breakouts, if you have deeper, more inflamed breakouts, that is going to make you more prone to scarring, but I don't want you to think that just because someone has light or small amounts of acne that they can't get scarring from that as well. And it's also thought that if you manipulate your acne, whether you are poking or popping your acne blemishes, that it's going to make you more prone to scarring as well because you're adding additional irritation and subsequent inflammation to that tissue. The longer your acne goes on and the more breakouts you have and the more severe your breakouts are, the more likely you are to have scars from your acne, which is why I think it is so important important that if you are concerned about acne scarring and you're still getting active breakouts, it's really important to get plugged in with a dermatologist. I say this time and time again in my acne clinic when I'm counseling my patients, especially my patients who are in their teenage years who might be just starting to get acne. It is so much easier to treat acne than it is to treat acne scars. So if you can get in front of your acne and really get it under good control, you are going to be set up for a lot more success. Now, it's not to say that if you have acne scars, we can't do something about it. Of course we can, but I just want to make that point so clear because I have a lot of parents who might delay bringing their kid into a dermatologist because they think their acne isn't that severe or it doesn't really bother their kid. And I totally understand that perspective. But if you see that your kid is getting scarring from their acne, I think it's imperative that you at least give them the option to treat it. Because I have lots of teens who sit in front of me who are clearly getting scarring acne and they're not that bothered by their acne. But what I can tell you is I also have tons of adults who come into my clinic who said, yeah, I didn't really care about my acne when I was a kid. I didn't really do much to treat it. But now I'm dealing with the consequences of that and all of these scars, and they're really bothered by it. Also, if you do all the right things in terms of treating your acne, you still can get scars. And I don't want anyone to feel bad about that or like they messed something up. Scarring is just something that happens to humans. And depending on your genetics and some other factors, it's going to determine how severe it is. But just know there are things we can do about it. If you're just at the point where you have discoloration, whether that's brown marks or red marks or some combination of those, there are topical things you can use in your skincare routine to help. First and foremost is going to be sunscreen. UV radiation is going to make brown spots and red spots worse, so you want to be protecting your skin from that insult. 2, I'm a big fan of retinoids, whether that's over-the-counter retinol or retinaldehyde or adapalene versus prescription tretinoin. All of those can help fade some of the dark marks and the red marks that come with acne. However, I do not want you to think that over-the-counter retinols can improve acne scarring. So many times I have patients come in for an acne scarring consult and they're like, well, I'm using retinol. And sometimes they'll say, I'm using retinol 2 times a week. That's going to do absolutely nothing for the textural irregularities in your skin. Now, there is some data to support the use of prescription retinoids like tretinoin and tazarotene to aid in the improvement of acne scarring, because we do know that retinoids can help your skin build back collagen, but this is not going to help severe, deep acne scars, but it will help with mild texture. Retinoids are also great because they help treat acne, so it's nice if you are acne prone to continue to be on a retinoid because you get some improvement of the scarring and you're preventing future breakouts. When it comes to addressing post-inflammatory hyperpigmentation, so those dark marks that come from acne, one of my favorite over-the-counter serums is by a Korean brand. It's called Numbuzin. It's their vitamin concentrate serum. This has a whole slew of brightening agents and antioxidants in it, like tranexamic acid, glutathione, niacinamide, vitamin C, arbutin, and to me it's one of the most affordable and effective lightening serums that exists on the market. Now, if you want to step up from that when it comes to treating dark marks on the skin, prescription hydroquinone can also be really helpful. Oftentimes when I have patients in my clinic who are dealing with active acne and they have a deeper skin tone and I can see they're developing post-inflammatory hyperpigmentation, at the same time that I'm prescribing them their acne regimen, I am also prescribing them hydroquinone to treat some of those early scars. Now, when it comes to improving post-inflammatory erythema or the redness that comes from acne, I really like azelaic acid, and I'm also a huge fan of our Prequel Redness Reform Serum. Azelaic acid is something we use to treat acne, but it has been shown to help with redness. It comes as a prescription, but you can also get it over the counter. For example, Naturium has a really great topical azelaic acid emulsion. And then the Redness Reform Serum from my brand Prequel has been shown to help with all types of visible redness in the skin. So if you're treating acne scars at home, I want you to understand that this is going to be very modest improvements. It's really working on the superficial aspects of the skin. We are not thinking about deep collagen remodeling with anything that we're doing at home. So let's pivot to what you can do in the office to get those deeper treatments. When it comes to in-office treatments for acne scars, the type of intervention that is needed is really going to vary based on the type and the severity of scarring. But one thing that is generally true across the board when treating acne scars is that they are notoriously stubborn and they usually require many treatments to get the improvements that most people are seeking. I think it's really important that a patient's expectations are really well managed, because often when we are thinking about an acne scar improvement journey, we are thinking about a journey that's going to take a year or more. When we do these treatments, we are essentially asking very scarred, damaged skin to rebuild itself. And some skin is going to respond very favorably to these interventions, and some skin is not going to. And until you get in there and start doing the treatments, you cannot tell who's going to do what. When we are doing treatments to remodel acne scars, we are exerting controlled damage, and we are asking the skin to respond to that damage by building itself back stronger and more normalized. The reason multiple sessions are needed is not only due to the extent of the damage, but also there is a limit to how much damage or how intense a treatment can be in order for it to still be safe for the patient to have. The more aggressive the treatment is, the more downtime the procedure is going to have, the more risks to the patient there are regarding infection and irregular pigmentation, and so slow and steady often wins the race when it comes to acne scar treatment. So things I'm going to talk about are chemical peels, laser resurfacing, surgical things, filler injections. There's so many different ways to tackle scars. And what's also important, aside from understanding that multiple treatments are often needed, is that multiple types of treatments are often needed to get the best results. First up, you have something called TCA cross. TCA is trichloroacetic acid, and then cross stands for chemical reconstruction of skin scars. And TCA cross is where you take a very high concentration of TCA acid and you deliver it deep into the base of an acne scar. And this is really going to be the most helpful for those ice pick scars where you have that deep V. You can drop the trichloroacetic acid right in the base of that, and then it causes controlled damage there and the skin can fill in as it heals. And I want to be really clear here, we are not injecting the acid, we are dropping it into the base of the scar. Now, something that's a little bit tricky about TCA is that it's quite powerful. You are using it at a high concentration in order to get it to perform that skin remodeling that we're hoping it does. But there is a risk that TCA can cause irregular pigmentation of the skin or even cause widening of the scar. So oftentimes, if I'm doing TCA cross for someone, we do a couple of test spots to ensure that their skin responds favorably before they treat their whole face. Another type of chemical peel that is done more globally on the face is something called a phenol peel, and they're actually not done that commonly in the United States, but I think thanks to TikTok, a lot of people have heard of them. And a phenol peel is a very deep chemical peel, and essentially the entire surface of your face will peel off as you heal from this. This is like a big deal peel. You have to be on cardiac monitoring, you have to be heavily sedated to undergo this, and that's why you won't see a lot of dermatologists, at least in the United States, perform this procedure. There is quite a bit of unpredictability with it, and you have to be so experienced in order to do this properly and safely. Also, the recovery for this is pretty intense. You're looking at a couple weeks of shedding skin, raw skin, and that does put you at risk for things like irregular pigmentation and infection. The results are fantastic when it's done correctly, but the downsides of not having it be done correctly can be devastating, and there are cases of people dying from a phenol peel. So I would say chemical peels are not my mainstay way of treating acne scars for my patients, aside from TCA cross for those specific ice pick scars. Now, if someone has a lot of hyperpigmentation from their healing acne marks, I do like a salicylic acid peel. In this case, I'm usually using salicylic acid in a range of like 20% to a 30% concentration. This is obviously much higher than the 2% concentrations that you get over the counter. The reason I like salicylic acid is that it is safe for a wide range of skin types, and also you can cover quite a large surface area for this. So I'm actually not typically doing this for someone's face. It's not uncommon that I'll have someone who has a ton of acne marks on their back, and it's just not practical for them to use at-home brightening agents or apply a retinoid to their entire back. So salicylic acid peels monthly in the office for a series of 3 to 6 can be really helpful. But as a reminder, salicylic acid peels are very superficial. They're not meant to improve texture. They are really there for improving the discoloration of those marks. Now let's get into laser resurfacing and microneedling, because I feel like that's the real meat and potatoes of acne scar treatment. The beauty of lasers is, one, some of them can penetrate deep into the skin where that collagen is irregular and really help remodel the scar that way. The other thing lasers introduce is this element of heat, and heat is really good at promoting new collagen formation. The two most common categories of lasers that are used to treat textured acne scars are non-ablative fractionated lasers and ablative fractionated lasers. Non-ablative fractionated lasers work by introducing columns of heat into the skin. Rather than vaporizing columns of tissue the way ablative lasers do, they are heating columns of skin, so they are a little less intense. And then by creating these heated columns in the skin surrounding those heated columns can begin to remodel itself. And non-ablative fractionated lasers have also been shown to be a bit safer in skin of color because they're a lot less likely to cause hyperpigmentation. This laser, so in my case, what we carry in our office is a Fraxel Dual, is probably the most common acne scar treatment that I do in my office, even for people who do not have deeper skin tones, because the nice thing about these non-ablative fractionated lasers is the downtime isn't very much. You probably have 2 to 4 days of redness, a little bit of swelling, very tiny bits of flaking, but it's very manageable for these patients. And they're typically doing a series of 5+ treatments spaced every 4 to 8 weeks. Now, in my experience and per the literature, these are much better at treating sort of like mild to moderate acne scars. They are not going to help really deep acne scars resolve. And they work best on those boxcar and rolling scars. They do almost nothing for an ice pick scar. Now, if you want to step up from a non-ablative fractionated laser, then you're looking at an ablative fractionated laser, like a CO2 laser. CO2 lasers actually vaporize columns of tissue within the skin. So you're getting a lot more destruction with each treatment, but you also have a better chance of more improvement with each treatment. And this is still not like a one and done thing. Often a series of 2 to 4 CO2 laser treatments are needed to address acne scars. This is going to have more downtime. You're looking more at like 4 to 7 days of downtime. You're going to have a lot more raw skin. It may be a bit more uncomfortable, and the treatment itself usually requires more numbing and sometimes even sedation. Now, I think if you're trying to have the best possible outcome for your acne scars and you have a lighter skin type, CO2 lasers are really where it's at, if you have the finances and the downtime to do that. Now, technically, you can do a CO2 laser in someone who has a deeper skin tone, but they are at a much higher risk of hyperpigmentation, and a lot of patients are really wary of taking on that risk. Aside from the fractionated lasers that help with tissue remodeling, I also will often use my V-beam laser, which targets redness in the skin to help with that post-inflammatory erythema that I talked about earlier. Ooh, and one thing I did not mention earlier that I think is so important is that if you are treating your acne scars, the sooner you treat them, actually the better they respond to treatment. That's not to say you can't treat acne scars that are 20+ years old. You certainly can, but if someone is kind of done with their acne journey and has newer, fresher scars, those will generally respond better to treatment. Now, pivoting away from lasers, I do want to talk a bit about microneedling because sometimes this is a more cost-effective method for patients to tackle their acne scars. So microneedling is kind of exactly what it sounds like. It uses very tiny needles that are placed into the skin to cause localized trauma to the skin. It's also known as collagen induction therapy because once you introduce those needles, as your skin responds to that controlled wound, it builds itself back stronger. Now, I find that microneedling works best for mild to maybe moderate acne scars. Because you're not introducing heat to really rev up that collagen production, it's really unlikely that traditional microneedling is going to help much with severe scarring. The other really nice thing about microneedling, aside from being a bit more cost-effective than traditional lasers, is that it also is safe for all skin types. So whether you have very fair skin or deeply pigmented skin, microneedling, when done correctly, is not likely to lead to any pigmentary issues. Now, if you want to rev up the intensity and the efficacy of traditional microneedling, you can do radiofrequency microneedling. With RF microneedling, you not only have that controlled trauma of the needle at play, but that radiofrequency label means that you are also introducing heated needles. And remember, heat really helps with scarring. And just because you're doing radiofrequency microneedling, that doesn't mean that you still don't need a series of treatments, but you usually can help with deeper scars that way. Also, it's important to note that radiofrequency microneedling is usually at least twice the cost, if not more, than traditional microneedling, so it's just something to be aware of. Now, when you look at radiofrequency microneedling versus CO2 laser, for example, there's not a lot of data that sort of puts those two devices head to head. I would say most acne scarring experts would prefer a CO2 laser, but RF microneedling is going to be the right answer for some people, especially people who have a deeper skin tone. And that's true of a lot of different cosmetic interventions. There's usually not one best answer. There's usually multiple ways to approach it and achieve similar outcomes. Now, aside from lasers and microneedling, there are some surgical modalities that I think are important to discuss. And the main one I want to talk about is a procedure called subcision. Now, don't get squeamish on me, but with subcision, I am essentially taking a sharp object, whether that is a needle or a cannula or sometimes even a blade, and I'm inserting it underneath the skin, and then we kind of wiggle it around. And the whole point of subcision is to break up scar tissue underneath the skin. When you have atrophic or these sort of bound down acne scars, I kind of explain it to my patient like you have the ceiling of your skin and the basement, and there's a tether of scar tissue holding those two things together, and it's sort of anchoring it or pulling the surface of your skin down. So with subcision, I'm essentially breaking that tether up so that that overlying skin can kind of rebound and pop upward. As I alluded to, there's sort of a variety of techniques that people use to perform subcision in terms of what instrument or tool they are using, but this is such an important part of acne scar treatment. And I feel like people aren't really offered it enough, but when you talk to the acne scarring experts out there, subcision is such a key tool, and it can feel a bit barbaric or simplistic realistic. We have all these amazing lasers and microneedling devices, but ultimately sometimes a surgical intervention where you are going in there and physically breaking up the scar tissue is going to yield the best results. Now, of course, subcision does come with its own set of risks. I would say probably the biggest risk is bleeding or the development of a hematoma. When you're going in and you are cutting tethers of scar tissue, you can also cut through blood vessels, and blood vessels are great at regenerating themselves. That's not going to lead to any long-term problems, but you could end up with a pretty gnarly bruise as you're healing from that procedure. So ideally for acne scar patients, especially if they have moderate to severe scarring, are having some form of subcision performed plus laser resurfacing or microneedling. You can also do something called punch excision of acne scars. This is not something that I offer to my patients, but can be done in some clinics, where you essentially take a little core right over every acne scar and you remove the scar, like you physically take it out of the skin. And then because you now have a little hole in the skin, you place a stitch there, which usually comes out a week later. Another common tenet of acne scar treatment is not just breaking up that scar tissue and remodeling that collagen, but also filling the space that those acne scars have left behind. You can use traditional hyaluronic acid-based fillers like Juvederm or Restylane to fill in some of those divots or those rolling acne marks, but you can also use biostimulatory fillers that help your skin produce collagen and elastin like Sculptra or Radiesse to get that same effect. Now, it's pretty rare that I'm just filling someone's acne scars without performing some of these other treatments, but it can be a nice complement to whatever else we're doing. And sometimes people say, ooh, I don't want to do like filler into my acne scars because doesn't filler just like go away after a year, and am I going to have to keep repeating it? What I've found, and what a lot of my dermatology colleagues have found, is that when you place filler into acne scars, it tends to hang around for a very long time. And especially if you're using a biostimulatory filler like Radiesse or Sculptra, you are asking the skin to make collagen. So once you've made that collagen, it's yours to keep. Now, all of the treatments I've talked about thus far are to improve pigmentation or indented acne scars, but I do want to spend a second talking about what you can do if you have a raised or hypertrophic acne scar. And typically for that, we are going to be doing some type of steroid injection. Steroids can cause shrinkage of the tissue, and so they can really help flatten out those scars. Occasionally, we will also combine a steroid with a chemotherapeutic agent called 5-fluorouracil, and those two together can also help flatten scars. And usually if we're doing these types of injections, we are doing them every 4 to 6 weeks until the acne scar is as flat as we hope it can get, and we are not noticing any side effects from those injections surrounding the scar. The whole point of us doing these steroid injections is to induce atrophy or flattening of the tissue, but sometimes that steroid can begin to bleed or leak into the surrounding tissue around the scar and cause atrophy of that tissue, and that's not what we want. So there's always going to be a limit to how much improvement we can get of a raised or hypertrophic acne scar without inducing unwanted changes to the surrounding skin. Now, I know I've sort of talked about this throughout the video, but I just kind of want to reiterate some of the expectations you should have if you're doing acne scar treatments. One, you should expect to do multiple treatments, and not just like 2 or 3 treatments, sometimes like 4, 6, 8 resurfacing treatments to get you where you need to go. Also, the more gentle the treatment is, the more treatments you're going to need. And that's completely fine. Actually, most of my patients opt for sort of this low and slow approach to their acne scars. The other thing that I haven't really talked about yet is what kind of results you can expect. If you go into your acne scar treatment journey and you're expecting to have 0 acne scars at the end of that journey, I think you will be disappointed. Typically with my patients, we are talking about a 50% reduction in their scars. And sometimes the scars go away completely, and that is so amazing when that happens, but ultimately the goal is to significantly reduce the scars. And the more treatments you do, the more likely you are to improve those scars more fully. But what I've found is a lot of patients are super happy when they have a 50% improvement, and they weren't really looking for their skin to have 0 texture or 0 evidence that they ever had acne, but really just to feel more confident in their skin. And you don't need complete removal of your acne scars to have that. Have you seen any success with acne scar treatments? What has worked or not worked for you? Please share in the comments. Don't forget to like this video and subscribe to the channel, and I'll catch you next time.